Normally after menopause, woman no suppose bleed again. Now where the blood they come from? But you go see say blood just they come out. How come? Cervical cancer don't take over.
This one na my health and eye program with Mama Future from Future Sake Foundation. And today I dey for Rivers State University. We want talk about one better talk with the worry women. This one is choke. So my sister dey here, we want to tell us something about it. My sister, what's your name?
Okay, my name is Esther Olonta, and I'll be talking on cervical cancer. I'm a 200 level anatomy student, Rivers State University, Faculty of Basic Medical Sciences.
Okay. Now some people don't know what's in the cervical cancer. This one when they talk cervical cancer, they just hear them everywhere. Cervical cancer. What be this cervical cancer? Now we want to talk about it. Tell us what be that.
Okay, cervical cancer is a cancer that affects just women generally. Yes, and it occurs when cancer cells grows on the cervix. Now, most women don't even know which part of their body is the cervix. The cervix is a part of the uterus that is just before the vagina. That means it demarcates a larger part of the uterus from the vagina. Okay. It's like a donut shape, kind of. So this cervical cancer we're talking about, this is when cancerous cells grow on the cervix. This can start when the cells of the cervix eventually change to precancerous cells. Now, when we talk about precancerous cells, it doesn't mean exactly that these cells eventually become cancer cells. It just means that it is about to or might change to cancer cells. When precancerous cells, the cervix cells start changing to precancerous cells, it might not eventually evolve into cancer cells for everybody, because we all know our body has immunity, so the body tends to fight against these precancerous cells. Okay. But in most persons, the precancerous cells evolves to become cancer cells, and then cervical cancer occurs.
Okay. Wetin she dey try explain be say inside woman body, the mouth of the womb na be the cervix. Some people don't know where that thing dey happen. It means say this thing go affect woman body inside. Now there the cancer now go come enter. So my sister, what will be the symptoms the person go fit take know say he get that problem?
Okay, before I emphasize on symptoms, this cancer gets stages. For the first stage, you no go know when it don't start to happen for your body. The stage 1 now, the cancer don't already start for the cervix. It never grow, it just small. So you as person no feel know say this thing don't dey your body like this. For the second stage, if cancer don't feel they grow, when this cancer spread, if it affect the other organs where they are around this your womb. For second stage, it don't they eat up some part of the womb, the uterus. Then for the third stage, it don't pass like that, or it don't dey reach vagina, it don't dey spread past the way it's supposed to be. Then the last stage now, where this cancer don't dey reach your ureter. Ureter na the tube where they pass urine from your kidney to your bladder. When this cancer don't reach stage 4, it don't dey reach your ureter, it don't dey spread past like that. Can be say wahala don't be. Now, wetin the symptoms of this thing for the early stages, like stage 1 or stage 2 of this cancer now, a woman fit dey experience foul odor from the vagina. Bad odor wey you sef wey get the body no go fit, you no go fit stand. Then watery vaginal discharge. Watery vaginal discharge, and sometimes the vaginal discharge fit dey bloody too. Then sometimes after sexual intercourse, you go find that say the person dey bleed out of nowhere, no wound, no nothing. You go just start to bleed. It no make sense. That be sign of this cancer. That means the cancer don't start. Then even after menopause, normally after menopause, woman no suppose bleed again. Now where the blood they come from? But you go see say blood just they come out. How come? Cervical cancer don't take over. That be the thing.
This thing where you dey talk now, my sister, they get solution. What in person go do, and which age the person supposed to do this to prevent them?
Yes, so this cancer, what in they cause them first of all now? Human papilloma virus, HPV. So the only way now to prevent this cancer now to take the vaccine, HPV vaccine, and it is advisable to give it to children before they are sexually active. That means for a girl, before you start to see menses. And children nowadays, they see menses from 9
Age of
years,
9.
11 years, 12 years. So before that time, you give your child the HPV vaccine. A girl, of course. The HPV vaccine is just 2 doses. The first one immediately at that moment, and then the second one should be taken 6 months after. You know, say we Nigerians, we sabi take things anyhow. If you take the first dose now, think say everything don't settle. And they no be so, you know, take the second one, the cancer will affect it, so if you attack at any time. So it is very important that you go for the second dose. Yes. And if maybe you don't know, say you're supposed to take this vaccine when you small and you don't grow, you don't pass that age. My sister, no fear. By age 25, age 26, you fit still go take the vaccine. Nothing will do you. Then the cause of this cervical cancer, risk factors, things wey fit make this cervical cancer come up.
Now the question wey I wan ask, now wetin dey really cause am? The risk, those people wey the thing go affect well, now which kind of people wey the thing dey worry pass?
For some girls wey start sexual life early,
we sabi chook anyhow.
Yeah, see chook.
We start to the chook early
around age 15, 16. Them they no want keep leg closed. Now those type them everywhere they go them dey. E no good. It dey affect you. As you see so now, if you start sexual life early, it go cause if it cause cervical cancer. Girls will get too much sexual partners. Pium, from one man to another.
It means say man fit carry am for body. You know they affect the man, but if he carry am go give him.
Na so.
Yes. So man go they carry and they share am. So those people will be say they know they sit down one place, then they very at risk. Easily. You go quick get this matter.
Okay. Even if as woman you keep yourself well. You can't go there with baby
man with
they up and down. If he get up, you know go show for him body, but you don't transfer and give you. Now we do talk. And not say even this virus, you know they enter if he catch you the first time you
not
get sex.
Yes, say not the only sex because it's insane just to touch body.
Yes, now it gets skin to skin contact.
Sweat.
This virus it pass. But then, when you touch skin, when we say skin to skin, we don't mean ordinary touching, touching of the genitals.
Yes. Where the thing dey,
of course. So if some people go feel say they won't use condom to prevent this thing, my dear sister, condom they cover every part of the genitals. It go still pass.
Sweat go carry and go inside.
You're not completely safe. You're not completely covered. So please, just the main preventive measure, take this vaccine and rest.
Okay. They mean say make you go health center now go take that injection. They call am HPV. Wetin this thing they do for body, you no go like am. You go see woman, the thing go chop am, pus go dey inside the womb, all the ovary, the egg, all go rotten finish. Before you know, the bladder don't be bring am out for outside. You go see woman see period finish. 2 weeks or 3 weeks, you go begin the flow water. Only menses don't take woman 1 week. Water go dey flow for woman body for 2 weeks. No be say na period, no be ovulation. No. Now those water wey don't dey rotting inside, and they come out. So this matter is serious. So it means say even though you know the waka, your husband dey waka, you see get problem. No be say na you waka pass, but the man wey dey carry come house. If he carry and like give away, come give you for house. My sister, good, make you go take this injection.